Hi, everybody. This is Dr. Britt Talley Daniel, MD. I'm a neurologist and headache doctor. And I'm dictating today podcast number 19, which is, Does Aimovig Help Migraine? Well, the migraine process generates three neurochemicals called neurokinin A, substance P, and CGRP. These neurochemicals are released by the ganglia of the trigeminal nerve and the cerebral arteries, and they cause the cerebral arteries to dilate and inflame the trigeminal nerve, the cerebral arteries, and the thalamus. The thalamus is the pain center of the brain, and no other medical problem inflames the thalamus like migraine does. Triptans, and there are 7 of them now, if taken early in the migraine process, 20 to 40 minutes after headache onset, they'll block the release of the inflammatory neurochemicals and are currently the best drugs for acute therapy for migraine. It's known that these neurochemicals are released in the brain by experimental research wherein a patient was given a drug to start the migraine and blood was collected from their jugular vein by a needle in their neck as the neurochemicals were on their way from the brain to the liver to be metabolized. And then it would go from the liver leave the body in the toilet. After the migraine started, there was a marked increase in the 3 neurochemicals listed above. Without treatment with triptan early, it takes 72 hours for the neurochemicals to leave the body. And some migraine patients with chronic migraine, and that's defined as at least 15 headache days a month, 8 of which have migraine features, they'll get this from overtreating with triptans. This is medication-induced headache. Triptans, caffeine, NSAIDs, opiate narcotics, or butalbital. And in this scenario, every time they drink a cup of coffee or take 2 more Tylenols, they get 3 more days of the neurochemicals, and the headache and the neurochemicals keep coming like gasoline you put on a wood fire. And the brain burns and the fire burns. So the question here today is, does Aimovig help migraine? Yes, Aimovig blocks the neurochemical CGRP, a neurochemical which is released in the migraine process and significantly improves migraine. In May 2018, the FDA approved a novel medication, Aimovig, co-developed by Amgen and Novartis for the prevention of migraines. It's a novel drug in the classic sense that its mechanism of action is different than other migraine medications, but perhaps more interestingly, it's the first drug recently developed specifically for migraine prevention. The only other previous drug like that was Sansert, which was used in the 60s, but now it's off the market. You can't get it. So Aimovig is a new preventive drug for chronic migraine, and it's delivered or given as a subcutaneous needle injection either in the top of the thigh or near the umbilicus in the stomach. All right, questions here. Does Aimovig interact with other drugs? Most modern drugs that are used in medicine are made from dirt, plants in the world, and are processed by drug companies and used to treat a specific illness. For instance, penicillin is a mold that accidentally dropped on an agar plate Fleming had put on his window ledge. And penicillin was then later manufactured and sold to treat bacterial illnesses. Penicillin has 10 different drug contraindications. This means that penicillin should not be used with 10 different drugs, which then may harm the patient. Aimovig has no drug interactions, NO. Aimovig can be taken with any other drug because it's made by DNA polymerization and then injected in the body. I tell my patients I've never had a drug like this. I've been practicing medicine 50 years. So what are the side effects from taking Aimovig? Serious side effects are hypersensitivity reaction. Common side effects are injection site reaction, like constipation, and muscle cramps or spasms. Serious side effects are very rare, and the common side effects are not that bad. Constipation may occur in 3%, but it improves with time. And the injection site reaction is like a small bruise one gets following getting blood drawn in your arm for lab studies for your doctor. So what are the benefits from taking Aimovig? Half the patients got 50% reduction in migraine headaches. Another 25% of patients got 75% reduction in migraine. And another 25% of patients, these so-called super responders, got 100% reduction in migraine headaches. So a quote from Alan Rappaport, a clinical professor in neurology at UCLA's David Geffen Medical School. says this is the most exciting thing about these drugs is not the FDA endpoints. It's the fact that they may significantly reduce migraine for a number of patients. He thought that about 30% of patients may see 75% reduction, and between 15 and 20% of patients who take this drug would get 100% reduction of migraine. And we never had anything like that. This is an astounding results for migraine therapy, and much better than the previous results of migraine preventive drugs. So what are the results of those drugs? The standard migraine preventive drugs are amitriptyline, topiramate, valproic acid, and the beta blockers, propranolol and atenolol. All of these drugs work indirectly in the migraine process, while Aimovig, blocking CGRP, acts directly in the migraine process. These older preventive drugs could reduce migraines about 30% in a month and had a lot of side effects that resulted in poor compliance, so that many patients just quit taking them. Amitriptyline is an older antidepressant active at a dose of 100 to 125 milligrams for treating depression, and it has reliable side effects of weight gain, dryness of mouth, and constipations. And neurologists use a dose of like 10 to 20 milligrams, low dose, with as it reduced but still active clinical side effects. However, it's the only migraine preventive drug, including the CGRP drugs, blockers, that help with sleep. And most migraine patients don't sleep well. Topiramate is used at doses of 100 to 200 milligrams and also has predictable side effects of tingling lips and fingers, Coca-Cola tastes flat, and trouble with cognition and word finding. Despairingly, patients call it Dopamax. Originally dosed every 12 hours, there's now a long-acting, once-a-day topiramate available as Trokendi XR and Qdexia XR. It was originally used to treat epilepsy, and it was found to help with migraine. Depakote ER, or valproic acid, is another anticonvulsant drug later found to help migraine that has a complete contraindication for fertile women. It may cause malformed or teratogenic defects in babies, which is unfortunate because migraine prevalence peaks at age 42, where 25% of women get migraine and they're still having their menstrual cycles and they can't take or shouldn't take Depakote. The beta blockers propranolol and atenolol prevent the vasodilation that occurs in migraine, but they can also slow the pulse. They may cause the so-called beta blocker tired syndrome, which makes them difficult to use, although propranolol had the first FDA indication for preventive drug for migraine in 1974. So the CGRP drugs changed migraine medication from combating cerebrovascular changes in vasodilatation. And currently, an increasing number of studies show that vasodilatation is not that significant in migraines anyway, and clinicians and some informed patients are excited that a new pathway is being pursued that will get at the excruciating pain migraines can cause. So there are two doses here. There's a 70 milligram subcutaneous dose and then 140 milligrams dose, and both of them are available for migraine patients. In general, doctors will start with a 70 milligram dose for 3 to 6 months and then move up to the 140 milligram dose depending on how the patient's doing. And patients starting a migraine preventive drug should always use a headache diary and count their headaches and the severity of their headaches. All right, what kind of injector is used for Aimovig? Aimovig comes in a 70 milligram or 140 milligram sure-click single-dose auto-injector. So how does this auto-injector work? Well, the auto-injector has a hidden needle. It should be stored refrigerated at 36 to 46 degrees Fahrenheit in a refrigerator in the original carton to protect it from light until it is used. If the auto-injector is removed from the refrigerator, it should be kept at 77 degrees Fahrenheit in the original carton, and it should be used within 7 days or thrown away. So you leave the auto-injector at room temperature before 30 minutes before injecting because it seems to make the injection not so bad. And how is the injection given? Well, you clean the thigh or the abdomen with an alcohol sponge. You place the auto-injector on the skin. You push the button at the end of the injector and a click will sound. And the medication will be injected subcutaneously in 15 seconds. Then another click will sound and you release the injector from the skin and dispose of it using a biologic needle safety site. If you're really interested in this, I have a blog post on this at my webpage at www.drmigraine.com. Just look at Aimovig treatment under preventive medicine. So this is the end of my statement on this. God bless all you patients with migraine. I'll see you again on another discussion. And please check my subscribe note down there so we can stay in touch with each other.